Al, thank you. This morning on Today's Health, chronic inflammation. It's a medical condition that develops slowly through the body, and if left untreated, it could lead to a host of health problems, and you may not even know that you have it. Dr. Keri Peterson is a board-certified internist and the contributor to Women's Health magazine. Dr. Peterson, good morning.
Good morning, Natalie.
Well, the article in the magazine calls it the enemy inside of us, chronic inflammation. Why is that, and what are some of the underlying health problems that it could cause?
Well, what we're slowly learning is that chronic inflammation is an underlying cause of a host of diseases. It's been linked to depression, heart disease, diabetes, allergies, so
even cancer.
Even cancer. So we are learning that this process is something, if left unchecked, can cause a whole slew of problems.
So what exactly is chronic inflammation, and what is the effect on the body?
So what chronic inflammation is when the immune system response goes out of control. Normally, when we get a cold or if we twist an ankle, the immune system is engaged, it sends white blood cells in, they come and they attack the infection, and we see the characteristic findings. We get pain, we get redness, we get swelling, and then once our body heals, they retreat. But in chronic inflammation, there's a faulty distress signal. So now the immune system is engaged unnecessarily, and the white blood cells come in, but there's no infection for it to attack. So instead what it does is it starts to damage our own tissue.
So how is it different, chronic, from acute inflammation?
So with acute inflammation, it's this short-lived attack where the immune system comes in, it does its job, and it retreats. With chronic inflammation, there's this continual trigger so that the immune system is consistently engaged, and rather than helping the body, it hurts the body.
And you talked about, for example, a cold or something could trigger the start of chronic inflammation. What are some of the actual triggers?
So there's several. One of them we know that's a trigger is being overweight. Basically, when your fat cells expand in size when you're too large, this triggers the immune system, and the immune system comes on in there, the white blood cells will inflame the fat cells, and that causes insulin resistance, which is why overweight people are prone to diabetes. It's directly linked to that. And also, if you're overweight, it can impact the liver as well. The fat cells in the liver, or the liver cells, can become damaged as well from being overweight.
And other things, if you're eating too many high fatty foods, that's something that can also then trigger this reaction. High anxiety, depression.
That's right. High fat foods like bacon, lard, fatty meats can trigger inflammation, and also a lot of the things in your diet. High sugar foods that have a high glycemic index, like the white carbs, potato chips, pretzels, trigger it. And you had mentioned stress. Stress and anxiety cause the production of a stress hormone called cortisol, and cortisol can trigger the immune system unnecessarily.
So some of the symptoms then, what would they be of chronic inflammation versus acute inflammation?
So that's the tricky part, Natalie, because
how you make the distinction.
Right, when there's chronic inflammation, there are no symptoms. We don't know when it's going on, whereas with acute inflammation, you see it. You see the pain, the redness, and the swelling. So there is no warning.
The joints, right.
Not necessarily. It depends on whether the chronic inflammation is causing a particular disease. So if you have rheumatoid arthritis, the underlying cause is chronic inflammation, and you get joint pain. But there are many diseases that don't manifest with symptoms at all until it's more obvious, like heart disease, for example.
Okay, so if it is then linked to, chronic pain can then lead to certain diseases, how do you test for it?
There isn't a direct test. There are some markers that you can check, like C-reactive protein is a popular one to see if you have inflammation causing heart disease, and there's one called interleukin-6. But overall, this is sort of an elusive process that we don't have a direct test for at this time.
Right, so how do we fight it if we don't even know it's there half the time?
Living a healthy lifestyle.
Right.
So there's lots of things you can add to your diet that can help. One of them is the omega-3 fatty acids. They are known to battle inflammation. They lower the white blood cell count, so incorporate salmon and shrimp and legumes into your diet. Fruits and vegetables, another great thing to incorporate in your diet, in particular the carotenoids that are found in orange and yellow vegetables like squash and like sweet potatoes, or the lycopenes that are in tomatoes and watermelon. Grapes, which are loaded with resveratrol, that's a hot topic right now.
And then just keeping a healthy weight and a healthy attitude.
That's right.
Healthy body, healthy mind. Dr. Keri Peterson, is always great information. Thank you so much.
Thanks.